Bismillah ar-Rahman ar-Rahim. Today I'm here to speak about surface anatomy and how important is surface anatomy in clinical medicine. And it is a must that all clinical practitioners should always revise and remember surface anatomy, because as we all know, anatomy is one of the basic sciences which are studied and learned in the first years of the medical education in the faculties of medicine or the faculties of health sciences, whatever they call it. And as a medical expert and as a professor of clinical medicine myself, I always stress on the point of importance of revision of surface anatomy. Surface anatomy is a part of what we call applied anatomy or clinical anatomy, and it is a fundamental aspect of medical knowledge. And it is a fundamental science among the basic medical sciences before studying the clinical sciences. And it is an essential part of clinical practice to always remember and correlate the clinical findings with what we call the surface anatomical projection or the surface anatomical points. And surface anatomy is actually, or is in fact, represents a link between external features and internal structures. It is simply the link between external features and external criteria which we localize on the outside of the body or on the surface of the body or on the surface of the skin, and between the internal structures. So the link between external features which we see, for example, in inspection in a clinical examination, or on which we put our stethoscope when we do auscultation in clinical examination, or even in the procedures of or in the steps of palpation and percussion, which are among the four main steps of clinical examination, as we all know, in internal medicine: inspection, palpation, percussion, and auscultation. So knowing the surface anatomy is essential in order to understand the projection of your deep structure. You have to study and revise always in all or regarding all the internal organs and systems, their surface projection on the outside of the body. That's why when I was a clinical examiner during my era of teaching at Cairo University in the Faculty of Medicine, Asr al-Aini, I was always asking students in the clinical examination about surface anatomy. Surface anatomy is essential in clinical practice. Again, in clinical practice, there is no good and skillful clinician with no knowledge of surface anatomy. In order to be a good clinician, you should always revise your surface anatomy. Anatomy is basic to understand the clinical sciences, and anatomy and surface anatomy is basic to do a thorough, skillful clinical examination and to understand its significance in clinical practice. This is if you understand and comprehend surface anatomy. It is very important, very essential. Always revise applied anatomy or clinical anatomy, and the most important of which is surface anatomy. Professor Dr. Tarek Ali. This is to all healthcare